Good evening, everyone. Thank you for taking time to join our Facebook Live talk. I'm Sayan, your host for tonight. Before we commence the talk, I would like to go through tonight's itinerary. There will be a sharing by Dr. Lee Guek Ng on understanding cervical cancer in young women. We have a Q&A session after the sharing, so do feel free to share your questions in the comment section. We will address them during the Q&A. Thereafter, I will end off by sharing on the upcoming events, including our next Facebook Live talk topic. 365 Cancer Prevention Society is a registered charity since 2003, and it holds an IPC status since 2010. So this means that those who would like to support us via donation can get a tax exemption. 365 Cancer Prevention Society is a charity that has cancer fighters and cancer survivors as our beneficiaries, and it follows by a trifold mission of cancer prevention, cancer fighting, and cancer education. To find out more information about our programs and services, please check out our website as well as our social media pages. Do like and share our social media pages with your family and friends. By liking and sharing, you will help us spread cancer support as well as cancer awareness and help us to reach out to more people. Also, do check out Icon Cancer Center's website as well as social media pages. Before we begin, a gentle reminder to all. Dear audience, kindly note that all information shared at this event by the speaker and 365 Cancer Prevention Society are for general information only and subjected to changes. Do consult your doctor for personalized and detailed medical advice. Thank you. Now let me share about Icon Cancer Center. Icon Cancer Center is a specialist oncology group in Singapore. Icon has 9 specialist clinics around Singapore with a specialist team ranging from medical oncologists, hematologists, and surgeons to cater to cancer treatments. Icon Cancer Center also has a health screening clinic located at Novena. It provides a full medical health screening at a one-stop location with seamless access diagnostic services. Do visit their website for more information about them. On to tonight's talk. Tonight's speaker is Dr. Lee Guek Ng. Dr. Lee is a program director of Icon Young Women's Cancer Program. She treats general oncology with a clinical focus in female cancer such as breast cancer and gynecological cancer. Dr. Lee was actively involved in setting up a tailored program for young women with breast cancer to help increase awareness and education. Tonight, Dr. Lee will share with us on the topic Understanding Cervical Cancer in Young Women. Without further ado, let us welcome Dr. Lee.
Thanks, Sayan. Hi, everyone.
Lee.
Yeah, thank you.
Now I'll pass the time to you.
Sure. Hi, everyone. Thank you for joining us on this precious Saturday evening, especially so close to Chinese New Year, right? Okay, let me start by sharing my slide. Okay, sorry for the delay. I hope everyone can see the slides. Okay, so the topic I'm going to talk about today is cervical cancer prevention and screening. It's very timely because this month is Cervical Cancer Prevention Month, and I'm happy to talk on this topic and share more knowledge with everyone. So my name is Dr. Lee Guek Ng. I'm a senior consultant medical oncologist, and basically my focus is on female cancers. So anything from breast cancer to cervical cancer, ovarian cancer, endometrial cancer, etc. My training, as for my training, I did a fellowship in Dana-Farber Cancer Institute, which actually is the first cancer institute in US that started Young Women Cancer Program. And I'm very honored to be able to bring back the expertise for local population. So I deal with a lot of breast cancer and gynae cancer, and even young women with breast or gynae cancer, as well as pregnancy-associated cancers. So for today's talk, I will take some time to talk about the background on the burden of cancer, and then I will give an outline on cervical cancer, as well as its risk factors, how do we do cancer prevention, and how do we go about doing screening. And very importantly, because more and more people are surviving cancer, we are going to talk a little bit about survivorship. Also, I think female cancers will not be complete if we do not talk about breast cancer and breast cancer screening because it is the most common cancer. So I'll just leave a few last 3 slides perhaps to just talk about cancer screening in breast cancer. So why are we trying so hard to do cancer education? I think it's important to take note of the statistics. Basically, in Singapore, cancer is the leading cause of mortality, and it accounts for 28% of the total number of deaths. So if we break it down and we look at the common cancer burden in both men and female, we see that breast cancer is really leading the pack at 70% age standardized incidence. However, cervical cancer is at the 10th, which is 7.1% age standardized incidence. I think it's very heartening to know that our effort with all the screening, promoting screening, as well as doing HPV vaccination program is actually paying off, and we are really seeing like a drop in the cervical cancer incidence. So generally, what do we want to look out for when we talk about cancer prevention, or as we grow older, we want to take better care of ourselves and to take note of our health? What should we look out for? So this is just a very rough guide, but I use the word caution so that we can go systematically and take note of things which may be amiss. So if we start with C, C stands for a change in bowel or bladder habits. For instance, if you used to go to toilet like every day and then now you're going to toilet once every 3-4 days, or you have to hit the toilet like 3-4 times a day instead of once every day, then that is a change in your bowel habit. So I think it's just a note that maybe if this is persistent, then you should get medical attention. The same for A, a sore that does not heal, or U, unusual bleeding or discharges somewhere in the body. T for thickening or lumps in breast or elsewhere. I for indigestion or difficulty swallowing. O for obvious change in the wart or a mole. Or N for nagging cough or hoarseness. I think the main thing to take note of is that this is a rough guide. Essentially, what you want to look out for are changes in the body which was otherwise not there, and which is new and which is persistent. So you want to highlight this and maybe seek medical attention in a timely fashion. So let's talk about what is cervical cancer. First, we need to understand a little bit about female reproductive system. To some people, it may be very complicated, especially for people who did not do any biology or have any biological background. So let's take a closer look, shall we? So when we look at the female reproductive system, is a system which comprises of a few areas. So if you look at the uterus, this is the uterus that houses a growing fetus. And then this is the fallopian tube, which connects to the ovaries. The cervix is actually this portion that connects the uterus to the vagina. And from the vagina, it leads to the external body via the vulva. So when we talk about cervical cancer, we are really talking about this canal here and the cells that surrounds this area. So essentially, the cervix has an outer surface that opens into the vagina and the inner surface that lines the cervical canal. And these two surfaces are covered by two types of cells. One is the squamous cells and the other is the granular cells. The most common cervical cancer is actually the squamous cell carcinoma, and it accounts for about 80 to 85% of the diagnosed cases of cancer. Adenocarcinoma is less common. It is also more difficult to diagnose because it starts higher up in the cervix. So how do we go about getting a diagnosis and workup? Essentially, as with most cancer, we always need a definitive biopsy to look at the cells under the microscope to confirm the diagnosis. And this can be done by colposcopy, punch biopsy, and cone biopsy in the cervical area. Of course, after we confirm the diagnosis, we have to work out further to determine the stage of the treatment so that a tailored treatment plan can be determined. So how do we go about that? We have to do imaging studies, and that usually includes a PET-CT scan or MRI of the pelvis. In some cases, if the cancer is deemed to be a little bit more advanced, and we think that it may be associated with the rectum or the surrounding tissue, sometimes we may even have to do scopes like a proctoscopes or a colonoscope to go into the intestinal lumen to see whether it is being affected. So this essentially makes up the workup. So next, of course, we need to understand the cancer to find out which stage is it at so that the a tailored treatment program can be carried out successfully. So when we talk about staging, it's usually stage 1 to 4. And when we talk about stage 1 and 2 and 3 and 4, essentially we want to know like whether it's early stage or late stage because it really parents a different treatment plan and prognosis. So stage 1 cervical cancer is cancer that is really localized to the tissue of the cervix. For stage 2, it can be beyond the cervix, it can be in the vagina area, and usually we delineate it by the upper two-thirds of the vagina. When it comes to stage 3, it is a bit more localized, so it can move on to the lower third of the vagina or even surrounding area. And when we talk about it being stage 4, it's usually quite distant in the spread, and while it's not curable, it is still highly treatable. So, what does the treatment encompass? Usually, for early stage cancer, we may even get away with a cone biopsy, which can remove the cancer cells in its entirety, or even like laser surgery or cryosurgery. If it's a little bit more advanced, sometimes we have to use surgery or even chemotherapy in combination with radiotherapy. However, if it has gone to other parts of the body, then we really need systemic treatment in the form of either chemotherapy, what's new is immunotherapy or targeted therapy. So, how does cervical cancer present? I think very importantly, we must be mindful and we must be vigilant about differences in our body that has happened as we age. So, the common symptoms of cervical cancer can really present as maybe even something as subtle as heavier than usual menses. But usually it is less subtle than that. It can present as vaginal bleeding following intercourse or in between periods, or even after menopause, or bloody vaginal discharge that may be heavy or have a foul smell. And sometimes it can be frank pain, like lower abdominal pain, or even pain during intercourse. We want to know, of course, the risk factors that can help us to differentiate and to act upon so that we can modify the risk and improve our risk profile. Sorry. So when we talk about risk factors, especially the modifiable risk factors, we are talking about sexual history, such as multiple partners, starting sexual intercourse at a young age, unprotected sex, etc. And even sexually transmitted disease can sometimes affect and augment the risk factors for cervical cancer. Smoking is also one risk factor, and taking oral contraceptive pills over a long period of time, more than 5 years, can sometimes increase the risk. And most importantly, human papilloma virus actually increase the risk to cervical cancer. And I will talk about this more in detail later on. So the non-modifiable risk factors includes age. So in Singapore and in fact globally, the peak age group for cervical cancer is between 30 to 49 years of age. And sometimes a weakened immunity, especially in patients who have concurrent HIV infection, or if they have had organ transplant and requires immunosuppression, mainly because if the body has a weakened immunity, it's not able to get rid of the HPV virus once they get an infection. So this augments the risk towards getting cervical cancer. So, what can we do to change our risk profile? I think what we can do is perhaps having fewer sexual partners. If we can't, then definitely we have to consider protected sex to reduce STD and also HPV infection. We can definitely consider quitting smoking. And of course, very importantly, something that we can really actively do is to go for screening as well as to do HPV vaccination, which is widely available now. So if we look at cancer prevention recommendations and we look at the American Institute of Cancer Research, they do have like very broad recommendations for cancer prevention. But these are all very intuitive, like something that we do know, right, for healthy lifestyle. For instance, we should be physically healthy, physically active, engage in exercise, keeping a healthy weight, eating a healthy diet, try to limit consumption of red meat, especially processed meat. Try to limit consumption of fast food and processed food, such as those that are high in fat, starches, or sugar. Limiting our consumption of sugar or sweetened drink, limiting alcohol intake, limiting smoking. So these are very broad prevention strategies that we can all undertake. And for cancer patients, so if you have survived your cancer, it's very important to follow a surveillance program where you still go back for follow up, still go back for your annual checkup so that you know if there's any recurrence, it can be spotted early on. So for cervical cancer, the targeted thing is to do cervical cancer screening. So how do we go about cervical cancer screening? Actually, it's very easily done. You can get it in most screening centers, in your health screening centers, or even in the OPD, outpatient um, GP practice, or even the polyclinic. So what you need to do is just a pap smear test. So if you are age 20 or younger, you do need a screening. But once you're sexually active, it's recommended to have a pap smear test every 3 years. And if you're 30 and above, it's recommended for you to get a pap smear test every 3 years, plus a HPV test together every 5 years. And once you reach a certain age group, yeah, like old enough, then you probably do not need more screening. So, what is essentially a cervical pap smear? Basically, it is the process involved inserting a speculum into the vagina and then using a brush. The brush will end up in the cervical canal and it will brush off some cells that then we can analyze it to detect even like cancerous cells or even precancerous cells. So next, I just want to talk a little bit about human papilloma virus vaccination. HPV stands for human papilloma virus. It's a very common virus. In fact, there are more than 100 over different strains of HPV, maybe about 150, but only about 40 of these strains causes cancer, and they are grouped into high risk types, those that causes cancer, and the low risk type, those that are non-cancer causing, but they can cause genital warts or premalignant lesions, etc. The HPV vaccination really helps to protect against specific type of HPV infection that can then potentially leads to cervical cancer. The most benefit of it is to start before one starts sexual activity. So currently in Singapore, there are three types of vaccines available, and we do recommend for young girls to start getting it from 9 years of age. And the age group that we target is 9 to 26 years old. So it's available in 2 dosing or 3 dosing. Please do speak to your doctor, either your GP or outpatient polyclinic about HPV vaccination, especially for your children. So I think during this COVID period, we heard a lot about flattening the curve. I think if we look at the curve for cervical cancer trend analysis, we see that the age standardized rate has in recent years came down significantly. So are we doing a good thing with regards to vaccination program, screening program? I think we are doing very well. So I just want to put the graph of breast cancer incidence and mortality side by side. We all know that breast cancer incidence is increasing every year. In fact, it's 70% of the female age standardized cancers. But despite that, the mortality rate for breast cancer is still more or less stable. And I still want to attribute this to successful screening programs and detection of early cancer. So all in all, I want to, really reiterate that screening is very important and we need to do screening. For cervical cancer, we also need vaccination to go hand in hand to bring down the curve. So I will switch gear a little bit to talk about treatment in young women. Because cervical cancer is not uncommon in younger women. The peak age group is 30 to 49. So really it is the younger women who are often affected. While the treatment doesn't change, it still depends on staging. But I think for younger women, there are a different subset of problems. For instance, for younger women, especially the age group between 30 to 40, early 40s, they are still in their reproductive age group. Hence, fertility preservation is a big issue. Is a big issue for younger women who desire family planning subsequently. However, fertility preservation for cervical cancer can be difficult in the later stage and is usually only possible for patients who are diagnosed in the earlier stage. Hence, this can be a big problem. In addition, I think for younger women, they are prone to a lot of other psychosocial issues. In addition to fertility, many women will become menopause with treatment. Hence, the early onset of menopause brings about a whole subset of issues such as bone, cardiovascular health, which may be implicated. With menopause, the sexual dysfunction can set in, and this can potentially affect marriage or social life. And once menopause sets in, for some women, they may be prone to weight gain. This may even lead to body image or self image issues, and subsequently, it can spiral into depression, mood issue, etc. So, fertility preservation is not the only subset of problems. So, for young women, I think it's very important that we address all this issue and the treatment is holistic. And because of all this, we have actually set up a young women cancer program to handle all these problems. And for survivorship, I think it's very important that any treating physician must work together with support network so that the patients that we are treating, they have options available. And we work very closely with a support network like 365 Cancer Prevention, even like Breast Cancer Foundation and Singapore Cancer Society. So now for the last part, I just want to spend just a few slides on breast cancer because I think it is very important. We can see the graph like going up. This is the breast cancer incidence. It is the most common cancer in female. So I just want to highlight while we are doing cervical cancer screening, while we are doing vaccination, for women, we cannot forego breast cancer screening. So what does it involve? It really involves mammography. So for women above 50 years of age, please contact your health screening or go to a polyclinic or your GP and arrange to have breast cancer screening in addition to cervical cancer screening. So 50 years and above, once every 2 years. For women 40 and 49, once a year. For younger women, if they have a substantial and significant family history plus personal history, please talk to your doctor about earlier screening. A lot of my patients come to me and say that they are very scared of mammogram. But I think once you know exactly what is the procedure, what to expect, that will reduce the fear somewhat. It is essentially an X-ray picture of the breast, so you may see this is a representation. Your breast will be squashed between the two plates, mainly so that we can get a clear X-ray picture to read it. And even though it may be uncomfortable, it is very fast. So there are some tips to minimize the pain. Just try not to get a mammogram perimenses because your breast can be very tender and it's more sensitive and it can be more painful. So why is this important for younger women? It is very important because in Singapore, especially in Asian population, the proportion of breast cancer in younger women, like 44 years below, it accounts for the proportion accounts for 1/5. If we compare it to the Western population, we see that it's only about 4 to 7% of the total breast cancer population. So we know that in Asia, the number of young breast cancer women is actually much higher. So in ICON, we understand that for younger women, they really face a different set of issues. And in fact, they have a lot of issues like psychosocially, endocrine side effects, hormonal side effects, fertility issues, and etc. So we have a tailored program where we bring the patient step by step through a cancer diagnosis, explain the treatment options in detail while offering them fertility preservation options early and in a timely fashion so that they can be referred to a oncofertility program. Time is of utmost essence here. I can't highlight that enough. And also, we offer genetic counseling and testing options because the the probability of it being a hereditary disease is higher for younger women with cancer. And of course, we offer counseling and support options for all young women with breast cancer or gynae cancer. So I think with that, maybe I want to draw this to a close. And if there's any question, please feel free to engage us in the Q&A session, and I will hand the time back to our host. Thank you.
Thank you, Dr. Lee, for your insightful sharing. We will now proceed to the Q&A session. And thank you all for sending your questions before the event. We'll do our best to answer all the questions. So one question that we have is, I undergo LEAP procedure for this I'm not too sure what it means, Dr. Lee. It says Chin 2-3, and the next month period is extremely heavy with blood blots coming out non-stop for at least 5 hours, then back to normal. Is this normal, Dr. Lee?
So I gather that you have had some procedures and after that you had heavy menses. This is expected actually after a procedure. However, if this is ongoing and if you are getting symptoms of like anemia, especially like giddiness or you're not feeling well, I think it's best to check in with the person, the procedurist or the gynecologist, whoever who did the procedure, just to be safe, right?
I hope this answers the question. Yeah. Moving on to the next question. After LEAP, my pap smear is still present of abnormal cells and need to do another procedure, DNC, after 6 months of LEAP. Why is this so? And also, after DNC, can the abnormal cells go off totally and pap smear be back to normal again?
Okay, so this question is maybe a little bit specific. It is best to check in with your treating physician because they will be more clear about what is your current situation. So generally, I'll just talk generally so that everyone can benefit from the discussion. So generally for CIN, which is early stage or pre-malignant lesion, CIN, there are gradings and there are grade 1, grade 2, grade 3. Usually for the CIN, they can potentially revert back to normal. So we just need time, and of course, close follow-up is a must. So I think it's important, and I'm sure your gynecologist is following up with you at a regular interval to make sure that the CIN goes back from 2 or maybe to 1. So it's important that it's a process. So we need to just follow up and to ensure that it doesn't progresses negatively, but in a positive direction.
Okay, thank you, Dr. Lee. Okay. We have another question in the comment section from Bhuvan Nesh. Is it normal that my period is 3 to 4 days?
So the duration of the period is really dependent on your age as well. So for younger women, it can be as heavy as like 6 to 7 days, because the hormonal drive is also a bit stronger. But for women, like if they are closer to the menopause, then it really tapers down to maybe 2 or 3 days. What's important is that you see a gradual decrease and it happens with age. If it's something abnormal, like if you have been having like 2 or 3 days of period and then suddenly you are getting like 7 8 days, and this is new and it has happened for like over a few months, and in addition to that you're not feeling well, if you have abdominal pain, etc., then I think it's very important that you get a checkup by a specialist.
Thank you so much, Dr. Lee. I hope it answers your question, Bhuvan. We have another question. If I am HPV positive and have a sex partner before LEAP procedure, is it true that most likely this sex partner also has HPV? And also, if I'm cleared of HPV and they are sexually active with the same partner, does it mean that I will get back HPV positive again?
Mm. So HPV, actually there are many different types of HPV. Like what I mentioned, there are maybe 150 strains of HPV of the virus strain. So out of which only 40 types are cancer causing. The main thing is that unless we check it, we don't know which exact strain you have and whether the sexual partner has the same strain. So, but the main thing to understand is that HPV is actually sexually transmitted. So even if you have a procedure done and you are able to clear the HPV, it doesn't mean that you will not get back HPV. So unless you do a vaccination, and if the vaccination is done early on, then you're protected against the cancer-causing strain of HPV. But the HPV vaccination also doesn't prevent existing HPV infection. So that's the rationale why we encourage and offer HPV vaccination program to young girls as young as 9 years old, because it's advisable to start the vaccination program before exposure, because essentially it prevents the cancer causing HPV strain from taking effect, and you're protected from a young age onwards, but it doesn't stop existing infection. Hence, HPV vaccination is actually for 9 to 26 years old.
Okay, thank you, Dr. Lee. I think this just nice is in line with one of our audience's question from Sel Neo. She says, good evening, doctor, and any age bracket for those who can receive HPV vaccines?
Sorry, the age bracket
Age
is
bracket
9,
for those who can receive HPV vaccine. I think it's
is
along the line with what you mentioned just now.
9 to 26. Yeah, 9 to 26.
Yeah. Also, we have another question from Claire Gosia. Hi, doctor. If we already have Gardasil vaccine before 26-year-old, do we need to take HPV vaccine again after a certain age? For example, after 35 years old due to newer strains?
I think this question must have come about because of the COVID, because we have to do
Yeah.
booster. Okay, so for the Gardasil, no, there's no data so far that we need booster, but basically for Gardasil, there are two types available now. There's the 4 and the 9. So it protects against different subset, but even if you had a 4, there's no data that you need a 9. So yeah, so it's not the same as for COVID vaccination where we need booster.
Okay, thank you. Thank you, doctor. Hope this answers your question, Claire. Another question that we have from Wendy is, how much is the cost of HPV vaccinations?
So the cost of HPV vaccination really range. It can be anywhere from 500 to 600 to 900. It depends on which type you're talking about, because actually there are three types available in Singapore now. The Cervix is the older generation one. It's very basic. That one is the cheapest of them all. And then we have the newer generation. So we have the Gardasil 4 and the Gardasil 9. So it really depends. And also, it depends on where you get it. If you get it in a polyclinic, or if you get it in a GP setting or in a health screening setting, it's all a little bit different. But of course, the newer generation will be much more expensive than the earlier ones.
Thank you, Doctor. Another question that we do have is how long does it take for HPV to go back to negative on its own, and how would we know?
So, like what I mentioned, the vaccination does not prevent or does not, basically, it doesn't do anything for existing HPV infection. So, with the main thing is that our immunity has the ability to get rid of the virus. It's like we can get rid of flu viruses and etc. Right? So the immunity does have the ability to do that. However, if you're immunocompromised, etc., then you will not have the ability to get rid of the virus effectively. So it really depends on your own immunity, and also whether at the same time, you have other risk factors. For instance, if you're smoking, etc., that also reduce your ability to clear the virus.
Okay, thank you, Doctor. We have a question from Eddie. My mom passed away a few months ago with cervical cancer. Is it possible that I have a high chance of getting cervical cancer as well?
Sorry to hear that. Basically, cervical cancer is not hereditary. So, if you are talking about, breast cancer, ovarian cancer, so that there are known genes that are hereditary and that can be passed down, because we have the BRCA gene, right? That is spread, that's hereditary. So, if your mother or your sisters have it, then there's a high likelihood that you have it. But this is not so with cervical cancers.
Okay, thank you, Dr. Lee.
Hmm.
Another question that we do have is if after missing the third dose of HPV vaccine for many years, do I need to retake the vaccine? And am I considered vaccinated?
So it depends on when you took the vaccine. So for young girls, if they are 9 to 13 or 14 years old, actually it's only recommended that they need 2 doses for them to get fully immunized. If you are maybe like 14 to 15 onwards, then usually the complete vaccination program will involve 3 doses. So again, it really depends on when you receive the vaccine, which type of vaccine, because some vaccines like Cervarix, the earlier one, the older generation one, even though it only protects against the HPV 16 and HPV 18, which is the two most common cervical cancer causing virus, it has a higher immunogenicity, and hence it works very well for this two strain. So it really depends on when, what type of vaccine, what age you had it.
Okay, thank you, Dr. Lee.
Mm.
We have a question in the comment section by Kavita Soni. She is asking for HPV vaccines, can they claim insurance for this?
Okay, so for insurance, I think I'm not too sure about the insurance, but I know that for the Cervarix and the Gardasil 4, you can use MediSave, provided you get it in a government setting like a polyclinic, and I think in fact some GP setting. So I think MediSave is claimable, but for the Gardasil 9, because it is relatively new, that one I think you still cannot use MediSave for it.
Okay, thank you, Dr. Lee. I think Kavita, for this, for the insurance claiming, you might have to check with your insurance agent for more information. Yeah. Another question that we do have is, what are the risk factors of cervical cancer?
So I highlight that in my talk just now. Maybe we can just recap. So
Mhm.
the main risk factors is smoking, starting sexual intercourse at an early age, having multiple partners, mainly because it is also a STD, and having multiple partners will expose you to a bigger range of the HPV virus. Also, concomitant use of oral contraceptive pills for a long period of time, and also sometimes the concomitant STD, such as chlamydia, can reduce the body's ability to fight the HPV virus and can be a risk factor itself. In addition, I think, yeah, mainly like smoking, etc. Yeah, I think I covered that.
Yep. Thank you so much, Dr. Lee. Another question that we have is how often should I be screened for cervical cancer?
So it depends on your age as well. Usually, if you are below 30, it should be every 3 years once you're sexually active. And if you're over 30, it's still recommended for cervical pap smear to be done every 3 years. But we also recommend to add in the HPV test as well every 5 years.
Okay, thank you, Dr. Lee. I think this question might be applicable to a lot of young women out there. Will treatment affect my ability to become pregnant in the future?
Unfortunately, for cervical cancer, because it's directly in the female reproductive area, so treatment is actually will affect fertility unless you are diagnosed at a very early stage. And I'm talking about like early stage, like stage one, where you can get away with just a cone biopsy or even a lead procedure, and then your fertility can be preserved. In later stage setting, like stage two, bulky stage two, stage three, or stage four, unfortunately, it usually involves some form of chemoradiation, and fertility can definitely be compromised.
Okay, thank you so much. We have a question from Chen Hongyu. Can I do PEP every year?
You can, but it's an invasive procedure, so it's uncomfortable. Unless you have CIN like one, two, or three that we need to follow up very closely. If not, just for general screening, is recommended once every 3 years will suffice.
Okay, thank you so much. I think we do have a question that's very applicable to current situation, COVID situation. Can I take HPV vaccine with COVID-19 vaccination?
Yes, you can.
Okay, yeah. Another question that we do have is, should I talk with a fertility expert before starting treatment?
Yes, you should. So, in fact, I just want to elaborate slightly on our Icon Cancer program, Young Women program, because I think it's very important for women to have a timely option for fertility preservation. So, for instance, in cervical cancer, before we start treatment, for instance, the treatment can be local, it can be cone biopsy, it can be a lip procedure, or it can be systemic, it can be in the form of chemotherapy, or it can be local plus systemic in the form of chemo plus radiation. Before starting the treatment, we need to, for women who wants fertility preservation, we need to get the patients to see a fertility expert in a very timely fashion so that, if they need to do IVF, if they need to stimulate to get the eggs out and preserved it, or embryo cryopreservation, all this can be done in an early setting. And it is best to be initiated by a medical oncologist because we are the one who knows, like, the urgency of the treatment, when to start the treatment, and we plan the treatment. So I think very importantly, talk to your oncologist so that you can get a session and a consult with a oncofertility person as soon as possible before initiating systemic treatment. And usually when you're diagnosed with cancer, there is urgency there, so we really need a timely discussion.
Okay, thank you so much, Dr. Lee. Another question that we do have, does endometriosis lead to cervical cancer?
No, endometriosis basically affect the endometrial lining. And while certain types of while some endometriosis can predispose to endometrial cancer, it really doesn't affect the cervical cancer as much.
Thank you, Dr. Lee. I think there is a question from Christine A. Russo. Can age 42 get HPV vaccine?
I think for specific individual patients who wants to get vaccination beyond the recommended age group, you will need to maybe talk to your GP or your doctor to talk about, basically it's about the lifestyle, the sexual history, etc., to determine whether it's still effective to get a HPV vaccine beyond the age bracket recommended.
Okay, thank you. Lastly, I think we have a question. Any diet to prevent cervical cancer?
There's no specific diet to prevent cervical cancer, but I think we know that smoking is a risk factor. So try not to smoke. And for diet wise, follow just now I flashed a slide on American Cancer Institute cancer prevention strategies. I think it would be prudent to just follow. Try to stay away from processed meat. Food high in fat, starch, sugars, and stay away from overly sugared food. So, and also healthy lifestyle and exercising and keeping a good BMI. Those are all cancer prevention strategies.
Thank you so much, Dr. Lee. We will wrap up the Q&A session now. Thank you so much, Dr. Lee, for joining us tonight and preparing such an informative sharing. I believe our audiences are able to take away meaningful and in-depth information about cervical cancer in young women. Thank you.
Thank you.
Yeah, and also thank you all for your active participation and questions. Now we would like to share with you on the upcoming activities as well as our next Facebook talk. Together with Icon Cancer Center, 365 Cancer Prevention Society will be organizing a Yum Cha with Doctor. So Yum Cha with Doctor is actually a closed group online workshop session organized with a specialist from Icon Cancer Center. Do note that this workshop will be by invitation only, and once the workshop date has been confirmed, we will extend the invitation for attendance. To register for Yum Cha with Doctor workshop, please scan the QR code shown on the screen now. Yeah. And also do share with us the topics that you are interested in when you're registering via the QR code. Last week, we had an online contest on our Facebook page as part of today's Facebook Live. Thank you all for your active participation. I would like to hereby announce the 5 winners for the contest. They are Rachel QP, Peng Gyok So, Elaine Wong, Nirmal Kaur, and Carol Guo. Congratulations to you all. We will get in touch with you over Facebook inbox message. And for the rest who actually joined this contest, thank you for your inputs. Do stay tuned to our Facebook page for more of such activities and contests. Also, please share with us your feedback for today's Facebook Live. Your feedback can help us improve future sharings via Facebook Live sessions. Yeah, I'll give you all a bit of time to scan the QR code, and the link for the link for the feedback form will also be in the comment section. Yeah. And on to our next Facebook topic. Our next Facebook topic will be in Mandarin, and the topic title is 放射治疗和副作用管理. This will be shared by Chen Guojun Yishen from Icon Cancer Center. Do mark down the date of this Facebook talk. It will be on the 19th of February at 8:30 p.m. And we hope to see you there. Finally, here is our, as well as Icon Cancer Center's website, as well as social media pages. Do like and share and follow us for more updates. So this brings us to the end of our Facebook Live. Thank you all for joining us tonight and have a great weekend and happy Chinese New Year. Goodbye.